Hello, my name is Shirley. I'm a mother of two that is here today to reach out to those who should know about the importance of breastfeeding their baby. There will be three main important reasons to breastfeeding your baby instead of giving him or her formula. We will talk about lesser chances of having severe illnesses and cancers, giving your baby the best milk that is full of the best nutrients for him or her, and even how breastfeeding can change and benefit the mothers and soon-to-be moms. Let's look into breastfeeding your child and how it can help them have a lesser chance of cancers and severe illnesses. Breastfeeding has a great effect on children and our unborn children. But don't think that it stops just there. Moms have benefits as well. As parents, we want the best for our children. Nobody wants to see their children be sick or ill. Alison Stoop, MD, stated that for infants, not being breastfed is associated with an increased incidence of infectious morbidity. They have and are at elevated risk of child obesity and type 1 and type 2 diabetes, leukemia, and sudden infant death syndrome. For infants not being breastfed, it is seen that otitis media, gastroenteritis, and pneumonia is affected more of these infants. A premature infant that does not receive breast milk is associated with the increase of necrosine and enterotosis. The American College of Obstetricians and Gynecologists therefore actually recommends 6 months exclusive breastfeeding for infants. The American Academy of Pediatrics and the American Academy of Family Physicians similarly recommend 6 months of life and the child's first birthday, or even there long after. Approximately 44% of infants will have at least one episode of otitis media in their first year of life, and the risk among formula infants is doubled at 95%. Several studies have examined associations between formula feeding and childhood leukemia, based on the hypothesis that immune reactive factors in breast milk may prevent viral infections implicated in leukemia pathogens. Now let's look at the mothers and perhaps how they benefit from breastfeeding their child. Lactation suppresses ovulation and leading lactation amenorrhea. Lactosis leads to terminal differentiation of the breast tissue, with potential long-term effects of malignant transformation. These effects can be associations between breast and ovarian cancer. There have been many studies that have suggested breastfeeding reduces breast cancer risk. There have been 47 studies found that each year of breastfeeding was associated with a 4.3% reduction in risk of invasive breast cancer. In the Nurses' Health Study, too, the association was stronger among women with a first-degree relative breast cancer. In this group, never breastfeeding was associated with 2.4-fold increase in incidence of premenopausal breast cancer, compared with never having breastfed. Most mothers make decisions about infant feeding and early in pregnancy. Early in prenatal care, it's better to get educated about the health impact for infant feeding and address potential obstacles to breastfeeding. Formula feeding is associated with adverse health outcomes for both mothers and infants, ranging from infectious morbidity to chronic diseases. How about the nutrients and why breast milk is better for your baby to consume? Breast milk is the perfect food for your baby. There are numerous advantages over baby formula. Breast milk contains active infection-fighting white blood cells and natural chemicals that give increased protection against infections in the first months. It contains the perfect proportion of nutrients that your baby needs, including a protein, carbohydrates, fat, and calcium. It is very easy for your baby to digest. It is also said to protect against allergies and asthma in the future. It has some of the fatty acids that promote brain development as well. Breast milk also naturally contains many of the vitamins and minerals that a newborn requires. It is all important information that could promote a better health for you and your child. Check it out and don't make plans on formula feeding your child too early in prenatal care. Research and find out how to give your child and you a better chance in not being at risk of these illnesses and cancers.